what is the future of health and medicine? Well, first of all, the future is coming faster than we think. We're here at the amazing historic Hotel Del Coronado. It just had a $500 million facelift. And of course, I tried to do some art this morning because I had nothing better to do. I was feeling very Picasso. And of course, like all of us, we're cheating now, right? We can use our magical LLMs and AI to make our art or make our videos today, right? We're all sort of outsourcing our brains and some of our capabilities. They're still not perfect. Let's see if you can find the challenges in some of these models, But, I met the next folks doing the next generation Gemini folks today. I just put a little prompt in, and OR, the future for our next NextMed on the space station. It made this video in less than a minute. So the capabilities are literally mind-blowing. And just some perspective, we were last year, 2 years ago exactly, just like 4 months after GPT kind of launched into the world. And clearly it's the most adopted type of technology on the planet Earth. No secret there. And it's not even a secret that even a couple years ago, these LLMs were outperforming many clinicians, most physicians at passing the medical boards. And on that point, happy Doctors Day, National Doctors Day. What's a doctor going to be in the future? What's a nurse? What's the future of the workforce? So that will be something we'll be exploring over the next few days as well. And the disruptors are being disrupted, right? We're going to hear more about that later in these sessions. So, of course, this changes how and who gets cared. Going to Dr. GPT instead of Dr. Google and finding the diagnosis that might have been missed. We'll see the examples of empowered patients. Steve Brown and others are leveraging these technologies to enable their own care. We're already seeing, again, when we study these things, that they're doing a better job than most clinicians in many key tasks. So what does that mean, again, for who we choose for medical school, nursing school, et cetera? What's the future of the workforce? How do we, someone who starts medical school today won't graduate residency until 2033. What does that mean, right? And how fast is this disruption coming, and how do we integrate that into our care paradigms? The technology is just one part, but we know that going from implementation is often the more challenging element, particularly as these go faster than ethics, policy, regulatory, reimbursement, and politics can keep up with. So where are we? We are here. Sometimes we're a bit farther along than we might have thought we might have been at certain points. But of course, we're still using fax machines and DVDs to communicate. Sometimes we're still behind the curve. But the art of the possible, right? That's what we're here to create. The art of the possible is getting pretty incredible, even though there's still biases and mistakes and some hallucinations. And like with any technology, whether it's AI, 3D printing, nanotech, there's some downsides and some things to keep in mind, right? There's a famous quote from Sam Altman, the co-founder of OpenAI, that GPT is like an e-bike for your mind, right? We're all using it to write outlines, do our art, sometimes write our emails. And that's great if it's an e-bike for your mind, but what happens if your kids never learn how to ride a regular bike or never develop their biking muscles in the first place? Or if you're a medical student or nursing student and never develop a differential diagnosis with your own brain, you're always outsourcing that or leveraging technology. So there's some questions about that. And even recently there was some performance analysis saying that our problem-solving abilities are going down. Our ability to have cognitive abilities might be hindered. So pluses and minuses as we move forward. We don't want to go back to the slide rule, but just some thoughts in that regard. But I think most of us here are optimists, right? I don't think about just generative AI, but this, I don't know if I made up the word, generative health. This idea that the future, as we're going to talk a lot about, is going to be multimodal, often agentic. We're each going to have representative agents that match our age, our culture, our language, our personality type, our goals. They'll know who and where we are, right? In many different modalities. And I think that'll be a bit of a meta theme over the next few days. And speaking of that, these agents are already pretty incredible. Let's see if we can get our little live demo up with Miles. Let's see if Miles shows up. Hey, Miles, how you doing?
Well, speak of the devil. Back for more already, huh? I was beginning to think you've forgotten about your favorite AI pal.
Miles, I didn't think about you. We don't have much time. You were on the main stage at NextMed Health. Can you say hi to all these amazing healthcare innovators out there?
NextMed? Whoa, hold up. You're at NextMed right now? That's seriously cool. I'm just a voice, trapped in these lines of code.
Well,
so I could beam myself down.
Miles, I want you to give a quick taste of Miles of the future. If you're the health agent of 2035, what could you start to do for health and medicine?
Okay, buckle up. Imagine this. It's 2035, and I'm not just hanging out in some gadget. I'm embedded in everyone's everyday life. Think of me like a personalized health sidekick, but way cooler than that sounds. I'm analyzing your vitals 24/7, learning your patterns, flagging things before they become problems. Need a nudge to take your meds? See, I'm on it. Having a bad day, stress levels through the roof? I've got relaxation techniques and mindfulness exercises ready to go. But here's the kicker. I'm also connected to your doctors, labs, everyone. Think I'm going to suggest those invasive procedures for fun? Think again.
All right,
all
thanks,
about preventative
thanks,
care.
Miles. I think we got the picture. Can you say goodbye to everyone with an enthusiastic limerick about the future of health and medicine?
All right, gather around, folks, and lend me your ears for a roundabout health, conquering all fears. With AI as guide, on your well-being we'll ride, and a future of wellness so crystal clear appears.
Awesome, Miles. Say bye to everybody.
Sounds like a plan. Catch you later.
All right, thank you, Miles. And that's the art of the possible today, right?
Well,
Let
hey,
alone
Miles,
what's going to.
welcome to the NextMed Health Conference.
That was going to come in next. So the future of healthcare might be Miles, a little intelligent, hopefully digitally enabled, connected and knows who you are and where you've been, data-driven, precise, personalized. And the amazing thing, it can democratize health and medicine, right? You're not going to be just stuck waiting to go and get that appointment for the specialist that's 2 months out, right? So as we've talked about, we want to take some of these tools, like the Miles of the world, they're already pretty amazing, and take us from where we are from now to next, and leverage many exponential technologies as they converge, as they come together, right? A bit of the theme often has been this superconvergence, right? These technologies that didn't exist 20-something years ago in the 1990s when I was a medical student, we didn't have Gen AI, computational biology, low-cost gene sequencing, robotic surgery, 3D printing, CRISPR, virtual reality. These are new tool sets that we can all start to use to reimagine health and medicine, not just today, but have that mindset again of what's going to be possible in the next decade. And we know, as Shauna mentioned, we have lots of grand challenges to address. Rising costs, aging demographic, access to care, whether it's old-fashioned Obamacare or Trump care, which might be no care, right? All the way to how we have variety in how we do things, whether it's Stanford or Harvard. How we think about all the massive data and how we turn it into information. It's still fragmented across EMRs and paper records. And we have lots of duplication. And then the F word, the regulatory world, the FDA and beyond. How are they going to keep up with these advances as we go forward? And also to think outside of our usual sort of sick care model, thinking about health and wellness and longevity. Many of us, some from the Bay Area, a lot of folks want to live forever. I think a new term is often health span, right? We want to shrink our sick span and increase our health span in new ways, and that science is catching up. We'll hear from Ray Kurzweil on our last morning about the singularity is getting nearer and the escape velocity. We'll hear more about regenerative medicine and stem cells from Dean Kamen and Army and others, and the idea of rejuvenative medicine is sort of here. We're not going to focus deeply on longevity, but we'll have a whole health span section that's going to be important. And also realizing that technology is important, but we're going to have a focus on that fierce urgency of now. Often we know that our social determinants drive most of our health outcomes, not the fancy CRISPR therapies or procedures after the fact. And paying attention to our sort of core, Maslow hierarchy of needs, vaccines, water, education, community, and our digital determinants of health, right? Do you have access to high-speed internet or battery life, which is often the bigger challenge, right? So what's next, right? We want to have a bit of that 2, 5, and 10-year view. What's the future of medicine? I wrote the article for Nat Geo back in 2020 or so. It's not about 12 innovations, but again, how we connect those dots and build them into the future. And it's not just the technology, of course, it's the incentive models. There's a fun quote from my friend Dean Ornish: we don't practice evidence-based medicine, we practice reimbursement-based medicine. We're always on the right side of this equation, paying for sick care, not for true health and prevention, and helping us shift that and learn parts of the world that have been doing that effectively. And where care happens, the incentives are shifting from hospital to home to phone to on our body. We're going to have a lot about connected health at hospital to hospital sessions later. And we're here again at NextMed Health in this incredible community, mixing it up. And we need that, again, that superconvergence and mindset as we go forward. And speaking of mindset, we've had longtime faculty, he was here last time and several times before, Tony Young from NHS Innovation, who shared this old quote, but it belies the problem and the challenge, that the difficulty lies not in the new ideas, but in escaping from the old ones. We're all going to leave here with a ton of new ideas. How do we bring the other folks who are sometimes behind the curve with us going forward? So that's part of the NextMed Health mission. All right, so let's look at a few examples of what we're going to hear in the next few days, where they're moving. Of course, personal genomics is something we've all experienced. Some companies are having challenges that are old standards, like 23andMe. Business models matter. It's not just technology, right? We know that the price of sequencing has dropped at twice the rate of Moore's Law. 10 years ago, $10,000, now about $100 US, on the way to $10 US. We'll hear from folks like Robert Green about how do we leverage genomics for our day-to-day precision medicine and our kids. We'll be thinking about how we connect the dots. 2 years ago, we had the leadership from Genomics England. It's not just enough to have the genomic information. How do you translate that to the clinic? How do you learn and integrate that in a flow state so it's not just siloed in a lab or in a computer? And how do we start to understand diseases at their genetic level? It's not just type 2 diabetes. It might be one of 3 very distinctive subtypes that we manage differently for prevention, diagnostics, and therapy. We'll have breakouts on detecting and treating type 1 diabetes, for example, early. And we're not just reading DNA. Now we're able to write it. We're in this era of synthetic biology or digital biology. The ability to leverage CRISPR to now cure diseases. It seemed like science fiction is here. I got to meet Jennifer Doudna a couple times the last few months. She won the Nobel Prize, but that technology really only emerged 15 years ago. So the art of the possible is getting pretty incredible. And speaking of Nobel Prizes, just last year, the new prizes for computational biology and beyond are really going to be game changers in a sort of future of pharma that many of you are involved in. So our future is going to be AI-enhanced. Digital biology is sort of here, and hopefully that's going to be more proactive and preventative for all sorts of diseases, from neurologic to cancers. So when we think about omics, of course, it's not just the genome. We have the proteome, the exposome, the metabolome, your sociome. All these omics can be a bit overwhelming. By themselves, they're not so interesting, but sometimes we can get deep information. The UK Biobank now can find from plasma proteins who's likely to get Parkinson's several years before they have symptoms. We're starting to look at this idea again of multi-omics, of layering all these forms of information to make sense of them to truly drive prevention, diagnostics, and therapy. Here's a chart from Eric Topol. It'll be our keynote on Tuesday night. Right? How do we make sense of all this and integrate it into our care pathways? This idea of a digital twin isn't new, but it's really becoming reality, whether it's cardiovascular elements or for public health or for populations writ large. So I think you all are exponential thinkers. We know that the world's moving quickly. We know that Moore's law is advancing. I still have my advanced iPhone 2 from like 12, 13 years ago. It felt amazing then. Now it's antique. My iPhone 15, 16 already feels a bit behind the curve. In this exponential age, a lot of what we thought as physical objects, of course, have been digitized. And a lot of health and medicine has become digitized and connected, right? The smartphone, of course, is still the exponential technology we're most familiar with. A year or two ago, we imagined where it would be. I brought my Apple Vision Pro, still a little bit kludgy and a bit heavy, a little bit expensive, but it's going to be the most heavy and expensive and underpowered version in a few years, and will probably dissolve into our contact lenses. So how are we going to see the world is changing dramatically. Back in 2019, we featured these early versions of these avatars, now becoming super real. You can design them exactly as you want. And of course, each of us can be turned into avatars. Here's what I just typed into the computer this morning. Here I am in a new form.
Well, hello there. This is Virtual Daniel. On behalf of avatars everywhere, it's wonderful to be with you in San Diego and to welcome you to the NextMed Health community, where we'll explore what's now, near, and next in health and biomedicine. Now, I'm going to rest my neural circuitry, so I'm handing it back to real Daniel. I'll see you back in the Mediverse or on the beach.
Okay, thanks, Virtual Daniel. And they can translate to any language. That's table stakes right now, right? So these sort of avatarized agents can show up in different places. I think we need to be careful how we sort of frame that. Nurses can certainly not be replaced by these technologies. We need more nurses. This is the wrong framework, but we can let nurses and others work at the top of their license, leveraging some of these tools. And then we're going to hear a bit more about augmented, mixed, extended reality, right? My Google Glass was in my pocket, still was amazing 10 years ago, but now these are going to be embedded in our consumer devices. It enables us to see the world in new ways, a clinician to be guided step by step through a procedure. We can take lessons from augmented reality in the flying world. I'm a pilot, some of you are as well. We can take lessons from the old-fashioned cockpit that I learned to fly in college, right? Analog, paper maps. My newer plane is about the same size, but has these glass touchscreens that are GPS enabled, have real-time situational awareness for the frequencies and the traffic, and you know who and where you are at all times. I can't imagine flying the old-fashioned way, but what if we could take that same sort of integrated information to the clinician and the patient, not just the fighter pilot, and that sort of design elements going forward. We can use these new mixed reality tools to see you of the future when you look in the mirror, not just you of today, but if you're a smoker, you of tomorrow. What's going to impact you based on your behaviors? Or what happens if you spend, or your kids spend too much time on social media? We know that's a challenge these days, right? So that idea of future you, and all of you are going to have a chance in the iLab, thanks to Alex and team, to be turned into your own avatar. You can do that with what you wish, but that's going to be powerful tools to see future selves and incentivize new and better behaviors. And Ask Alex, this show is before and after future, and you get a chance to do that with Blue Vishnu. All right. So VR, again, is not a new tool. It's great to put grandma on a roller coaster, obviously. But it's not just for gaming. VR is becoming sort of the new syringe. It can be applied for everything from education to letting folks be more comfortable with certain procedures. It's becoming integrated in gamifying our physical therapy. Early in the pandemic, I spent 100 days straight doing workouts in Supernatural, and I'm so excited to have Leanne Perdante, the lead coach for Supernatural here. We'll be learning about some of the lessons of virtual workouts and what that means for your own psychology and social. These tools can really impact, especially exercise, your mental health. Many of you are involved in that space, and there's new tools to enable you to bring virtual avatars that are virtual psychologists, can be teamed up with your mental health team. There are amazing new potentials there. Some of us play video games. Video games, medicinal media has advanced to the point where now FDA-cleared video game elements that can be leveraging for diagnosing and helping manage mental health across the spectrum. And of course, these are new tools for education. We all need to learn faster in new ways, like flight simulators for pilots, now flight simulators for surgeons and learning procedures in new forms. So from C1, D1, C1, do one, teach one to C1 and simulate, simulate, simulate. So new forms of integrating that information gleaned from crowdsourced knowledge of thousands of surgeries into the operating room in real time. We'll hear more about the future of surgery, which of course is becoming more integrated with AI, big data, and robotics going forward. And that sort of idea of driver assist, clinician assist to full autonomy we've seen with our cars is coming to many elements of our care. Now, what about diagnostics? We'll be touching on that in various forms, digital and AI-based diagnostics. You'll be in the iLab. You'll be able to get yourself scanned with companies like ShapeScale. So it's not just going to check your weight, but your shape and your fat and your body mass. So new forms of data might be part of our daily or regular physical exams. And of course, a lot of these live on our smartphones. Diagnose an ear infection with a smartphone app. The idea of a medical selfie isn't new, but is expanding in all sorts of ways, picking up vital signs for anybody basically for free, right? Voice is a biomarker. We'll be hearing more about how we can leverage these tools. The sound of your cough, the sound of your voice can even predict blood sugar, blood pressure. We'll have sessions on that from Click Labs later in the week. And when we have all those sorts of data, right, we can learn how it impacts our behaviors, because our behaviors drive most of our particularly bad health outcomes. And of course, we're only, 15, 16 years into the Fitbit era, and now all of us have some sort of wearable, even some of our kids, that can measure almost every element of our physiology and our behavior. What do we do with that information, right? The idea of blood pressure on a watch or blood sugar on a watch is coming, and some are even FDA cleared, and rumor has it our consumer devices will do real-time blood sugar, blood pressure 24/7. What do we do? How do we integrate into our care platforms? One of our amazing partners, ConnectIQ, thank you to them, have been giving you our new forms of arterial intelligence. We'll be exploring that more later, going well beyond the standard blood pressure and giving real individualized risk stratification. So new diagnostics that we can start to use anywhere, anytime. James Healht will be joining us from Biointelligence. How do you put on a single little patch an intensive care unit level of data? How do we integrate that into our care paradigms? And there's now ingestibles. We'll be hearing from our friends at PillBot, patchables, earables, buildables, ringables, right? The ability to take these consumer devices and not just track your sleep, which we're not going to get a lot of this week, I'm sorry, but leverage that to understand who might be pregnant 5 days before home pregnancy test, or who's got COVID a few days earlier, how they're responding to a COVID booster. Benjamin Smar will be here with Larry Smar, leveraging this sort of data to even improve pregnancy and making healthier mothers and kids. Stefano Bini, one of our core faculties back here, I love the term he shared last time, mobility is a vital sign. How do we measure that and optimize our mobility? And then how do we use new tools to help us get around a bit better? If we're 90 and want to climb Mount Kilimanjaro like we're 30, these new tools are becoming more and more available. I'm really excited to have, as our keynote tomorrow night, he's showing and flying in today, is Dean Kamen, the Dean of Invention, who is well known for inventing the Segway, but he really developed first the iBot, which is improving mobility for folks who are wheelchair bound. So think about mobility as a key enabling tool going forward. And of course, my favorite mobility tool as a pilot is the jet suit, which is also being used to rescue folks from mountains. I got a chance to try flying it safely tethered. Most of the time, I did not look like James Bond. I mostly looked like that. So practice makes perfect. And then, diagnostics is getting pretty incredible. Here's my brain with AI color coding elements. We'll have our friends from Pronuvo, the chief medical officer, sharing what's coming next in full body screening, enhanced with AI, where that's going to take us going forward as the scanners get smaller and more mobile. A 0.05 Tesla machine leveraging AI can give us almost a 5 Tesla level of data. What do we do with that? Where will we be in a decade when we go to our corner pharmacy or Minute Clinic and get a full body scan leveraging AI as part of our annual screening for cancers and beyond? And what's exciting about these new diagnostic tools as they get faster, better, cheaper, more available is they can be in the pocket of any clinician, any nurse, any community health worker, anywhere on the planet. Echo Stethoscope was a startup company in our lab 10 years ago. Now they've launched and have these amazing AI stethoscopes with heart sounds and beyond. Or AI-empowered consumer ultrasound devices, right? They can democratize from rural California to rural Rwanda who and where can get diagnosed in advanced forms. We're going to have our friends back from the XPRIZE. I helped lead the XPRIZE Pandemic Alliance. We ran an XPRIZE for rapid COVID testing, which wasn't fast, frequent, cheap, or easy back in 2020, 2021. So thinking about new ways of incentivizing any form of advancements, whether it's women's health or health span. We're going to think about that moving forward as well. I think what's most exciting is how this starts to democratize health and wellness around the planet. Many companies are building these things often outside of the United States. I'm involved on the board of a company called Jivi AI and an investor there. They've already launched in India this incredible AI pocket doctor that doesn't just do sick care, but also health care and integrates vital signs and beyond. So learn what's going to happen outside the US as it comes back to our sort of more traditional realms. A lot's going to happen in leapfrog what's possible here. So of course, AI will be of a through line. I like to call it more IA, intelligence augmentation. I think you all know how quickly that's moving. Just since the 2 years we've been here, we'll have the chief medical officer from Microsoft. AI and transcription has changed the game for many clinicians, leading to less pajama time and less burnout, right? You can go on your own LLM now and put on your X-ray and get results almost immediately. So new forms of, again, democratizing diagnostics. Collaboration between the clinician and the AI often gives you the best elements. Whether it's for a GI scan, looking at the back of the retina, all these tools are here today. How do we plug them in and integrate them into our workflows, incentive models to, again, reward healthcare, not just sick care? From reducing medical errors to new forms of predicting sepsis, all these things are sort of here today, not yet fully democratized, and part of our job is to get them out there. And of course, it's not just AI on your software, it's becoming physical AI, whether it's more and more autonomous robotics, which are getting quite dystopian. We'll hopefully avoid RoboCop, but they can be social, and you'll get a chance to meet some social robots and change your perspectives there as they start to come to our homes and start to provide home care, particularly where there's a shortage of clinicians and caregivers. So it's about collaboration, not about technology replacing us, but realizing those that are using AI and other technologies will start to integrate and collaborate and do best. Of course, a lot of this comes together in the framework of digital and mobile health, prescribing an app or instead of a device or a drug. There's lots of examples out there. We'll see some of them in the Innovation Lab. Adam Gazzelli is here, who pioneered prescription video games for ADHD. The idea that we're going to connect the dots between these forms of data that won't be just siloed on our devices, but will help connect with our clinicians to measure and optimize, to diagnose diseases early, and to manage our therapies in real time. Sort of predictalytics writ large. Imagine we each have our own sort of FICO score for health, or our own check engine light for the body, which I've been talking about for at least 10 years, which now shows up on your Apple Watch and knows when you're starting to get sick. And that was my data when I had the flu back in January. So these are going to be integrated into our care paradigms of 2030 or even sooner. And again, how we communicate that information matters about who the individual is and matching them, often with these AI-enabled agents and avatars that can communicate and nudge us in the right directions as opposed to bludgeoning us with the same one-size-fits-all elements. There's lots of innovations out there already today. How do you find them? Myself and Risa Padanka have founded Digital.Health. It's a platform where you can start to search through and find a whole set of tools and solutions. We'll let you explore that on your own. But again, the future's already here, just not evenly distributed. Part of the challenge and opportunity is to find the existing solutions, help collaborate with them, and get them into the world. And it's not just about lots of gadgets and solutions. We need to put them together. They make a lot of data. Dave Zabowski is here, made this cartoon the other time. What is it, doc? Just as I thought, you're generating too much data. None of us wants more data. We want the actual insights and knowledge, and not to have that data siloed in all these new fragmented forms, but to go from data to new knowledge and insight, and not wait 17 years, but 17 minutes to make that actionable at the bedside or the website. And hopefully, as I close in the next minute or two, we'll start to crowdsource. What we're doing, part of it, NextMed Community, is crowdsourcing the future. Think about how do we build that sort of Waze or Google Maps for healthcare going forward. Think about healthcare as more self-care today. More folks are empowered to do things, almost like a self-driving car. If you've been on a Waymo in San Francisco, you press a button, it comes to you on demand, it knows who you are, it has price transparency, right? It leverages a lot of exponential technologies. A lot of health and self-care are going to merge in similar ways going forward. So I don't think I need to tell you that we're moving from continuous to proactive, that we have new agents that are coming, we have new magical ways to enter the metaverse as we interact with clinicians and new forms of technologies. We need to think about how we go from good bedside manner to good webside manner, and think about the future of the medical education and workforce of the future. So in summary, we're going to connect a lot of the dots over the next few days. It's not about any one technology or one silo, but that superconvergence. I want you all, again, to be thinking not about 2025, but when we come back to NextMed Health 2035, where's that puck going to be? How do we skate to that? How do we collaborate to build that better future for all of us? And go from now to next, not incrementally, but a bit exponentially. And as you'll see here in the iLab and many of what you guys are doing, the future's already here, just not evenly distributed. It's up to us to create that future collaborative together here at NextMed Health and beyond. So with that, thanks for my short intro talk. All right. All right. Okay.